As we go through the age groups, there's the mortality, the risk of mortality comparing men to female is shown in this slide here. And what you really want to see here is that in the young decades of life, in boys and young teenagers, the risk of dying for male to female is about 1.26. So a man or a boy is more likely to die, a ratio of 1.4. But it really pops up to 2.6 in the third decade of life here. And then it comes back down again. So by age 85, again, the differences are a little bit less. And these are areas here that we need to explore. Why is this happening? What can we do to prevent that and to flatten that curve out a little bit? So again, is there a need for a men's health initiative? In 2000, the Commonwealth Foundation, this is out of New York, they commissioned a report called Out of Touch, American Men and Healthcare System, no different than in Canada. Their findings were interesting: significantly reduced life expectancy, much higher rates of death from heart disease and chronic liver disease, substantially higher rates of suicide and violence-related deaths, significant underutilization of healthcare services in all age groups. This report called for expanded efforts to address men's special health concerns and risks and their attitudes towards healthcare. Followed in 2002 by the World Health Organization's Madrid Statement. To achieve the highest standard of health, health policies have to recognize that women and men, owing to their biological differences and their gender roles, non-biological, have different needs, obstacles, and opportunities. So we face barriers to men's health, the biology. I mean, men are hardwired to be hunters and gatherers. That's just the way our brains have always worked. We're the ones who care for our families and children and not for ourselves. At least that's sort of the general hardwired attitude. There are the non-biological barriers, and those again will be reviewed shortly. You know, if you have a car, you worry more about your car than you do about your body. And it was a national survey that showed that 84% of men in this survey had their car serviced in the past year. When the same group of men were asked about going to a doctor, only 66% admitted to have gone to. 20% difference between your car chassis and your chassis. So, you know, men will notice when their car isn't working properly or something's wrong, but they really will not pay as much attention to their own bodies. I love what Woody Allen once said: sudden death is God's way of telling you that you are working too hard. And I ask this question: are men stubborn, stupid, or both? In 2005, the Vienna Declaration on the Health of Men and Boys was written and is being signed by individuals from around the world. You can actually sign it if you go to that website in the bottom right there at the European Male Forum. Recognize men's health as a distinct and important issue. Develop a better understanding of men's attitudes to health. Invest in male-sensitive approaches to providing health care. Initiate work on health for boys and young men in school and community settings. Develop coordinated health and social policies that promote men's health. So with that in mind, we've formed the Men's Health Initiative of British Columbia, and we had our official rollout yesterday with a media event and announcing our website, aboutmen.ca. And basically, in just a couple of moments, I'll sum up here what we do. It's an umbrella initiative. We're not trying to form something new. What we're trying to do is facilitate collaboration amongst the experts that are out there. When you look around British Columbia, we have some phenomenal people who have been doing their work, be it educational or research or clinical care. They've been doing it, and they've been doing a good job of it, but not always knowing what the guy next door is up to. And if you just inform people that, you know what, somebody over there is doing something similar, maybe you should collaborate, then the sum of the parts will be bigger than, sum of the whole will be bigger than the parts. So we want to reach out to men. We want to inform and educate the public. This is all about communication. It's about helping our primary health care teams, the primary care physicians, nurses, community workers, give them the tools to address the issues, to educate men. We have to reach out to the men who can't get to the doctor. Maybe they're working during the working hours and they can't get to a doctor's office. So perhaps we need to reach them by going to car repair shops or to football games and hockey games and reaching out to them there and to try to educate and to make sure that people understand that there are ways of improving that life, decreasing that gap between health and life expectancy through understanding that there are ways of prevention, screening, improving your lifestyle, and then early intervention strategies. Aging is not always pretty. It's amazing when I look at that. I was going to put my own pictures up there, but it wouldn't be quite as dramatic. And U.B. Blake said, if I'd known I was going to live this long, I'd have taken better care of myself. The point of life expectancy is that many men live beyond the average life expectancy. And so we have to hope that we can get more and more men to live longer by not dying when they're 20 and 30, and when they're getting older to promote awareness, risk assessment, and again, reaching out to them. If somebody can't come into the hospital or to the doctor, let's go to them. Everybody has a computer or access to a computer, be it at work or through their kids or whatever. Let them get to a computer where they can go to a website and find out what are my risks? Am I at risk for a heart attack next year or within the next 5 years? And so on. So we need to get to them with these strategies, encourage periodic examinations. There's still controversy about some of these screening strategies, but if done properly, I think we can save lives with all of them. And early therapeutic interventions. If you have diabetes, maybe sometimes you can't avoid it. If you eat a lot of fatty foods and sugar and cakes and ice cream, and you're going to maybe develop diabetes with that big gut of yours, at least control it. If you can actually control diabetes, blood pressure, cholesterol, exercise on a regular basis, and all those other motherhood statements, and I'm not here to preach to anybody about go out and exercise and eat well, but if you can, there's a list of about 10 items. If you can follow those, you can decrease almost by 80% the risk of dying relatively young of one of these diseases. So lay off the fats, red meat, smoking, sugar, booze, coffee, and enjoy life. And we have to remember that women are absolutely critical to this process. And I always, this is a big part of my life, is raising funds. We have to get money for this. Nothing comes cheap. Our foundation here at the Vancouver General Hospital UBC Foundation, in partnership with the UBC Foundations, we're trying to raise funds. If any of you have spare change you want to send our way, please do. There are only 3 endowed chairs in men's health in the entire world. 2 of them are in the UK, in one center, and one of them is in Germany, and it's not really functioning that well. So we've got a lot of room for improvement in that regard. Also, with respect to research, we need to do a lot better in research, and research is a big part of our Men's Health Initiative. We hope to see a lot of progress over the coming years. So to sum up, progress requires a vision. Alice said to the White Rabbit, "Which road should I take? Where do you want to go?" "I do not know," replied Alice. "Well, then it doesn't matter which road you take, does it?" I think we do know which road we want to go down, and we're going to take that road, and we're going to take some risks. We're going to experiment. We're going to try new things in this Men's Health Initiative without worrying about failure, because if we don't, then success will be superficial. That brilliant man, Wayne Gretzky, said if you miss 100% of the shots you don't take. So we are going to take the shot. We're going to seize the opportunity, and we hope that over the coming years we will become a world leader in improving men's health and well-being. So thank you very much for coming out and for your support of this initiative. I think it's an exciting time. It's very timely, and we're looking forward to, not instantly making men live longer. Maybe a lot of men don't want to live longer, but we want to make men live healthier, to grow old, or grow older without growing old, and all those cliches. So thank you very much again. I'm going to now